Massachusetts General Hospital VAD Dressing Change Kit. Before beginning procedure, cleanse work table with wipe, not provided in kit. Step 1. Sanitize or wash hands. Step 2. Peel open kit. Place mask on yourself and patient. Step 3. Put on clean, unwrapped gloves. Step 4. If necessary, use Freederm to remove old dressing. Step 5. Place skid-free drape on table. Unfold drape. Step 6. Put on sterile wrapped gloves. Step 7. Use first saline wipe to gently cleanse site, starting in the center and working out in a spiral motion. Repeat with second wipe. Step 8. Use ChloraPrep applicator to gently cleanse site, starting at the center and working out in a spiral motion. Allow to dry completely for 30 seconds. Step 9. Apply skin protectant to area where dressing adhesive will contact skin, avoiding immediate exit site. Allow to dry completely. Step 10. Use one saline wipe to dampen the silver side of the silver lawn dressing. Step 11. Apply silver lawn dressing silver side down. Step 12. Place gauze over silver lawn. Step 13. Apply dressing over insertion site. Step 14. Apply closure piece under driveline and over edge of dressing. Step 15. Use alcohol wipes to remove the old securement device. Step 16. Apply skin prep to area where securement device will be placed. Allow to dry completely. Step 17. Place driveline in center of the securement device. Step 18. Holding the driveline in place, pull tab on one side to create an opening in the slit and push the opposite tab through the opening. Step 19. Grasp both tabs and pull in opposite directions until tabs lock into place. Then apply device to patient. Step 20. The anchor should not cause any pulling or tugging at the exit site.